Hello everyone, my name is Catherine Siregar and today I will be presenting my case study number 2C on infant botulism. It caused by Clostridium botulinum. The case scenario. You are an emergency medical technician and are called to the home of Dante, a 13-week-old baby boy who has become listless and is having trouble breathing. His parents report that Dante used to smile, but lately he has not smiled or shown his usual facial expressions for the last 2 days. When you arrive, Dante's eyes are open, but he doesn't seem to be focusing. You place your outstretched finger under his fingers and he doesn't grasp it. You lift his hood and it drops back onto the mattress. His parents also report that he has not had a bowel movement in 3 to 4 days. The case uses the word listless, which means lacking energy or unusually inactive. A listless baby may look floppy, tired, or less responsive than normal. This definition is important because it matches the early symptoms of infant botulism. Question number 1. What is your suspicion based on what you seem to be nervous system symptoms? My suspicion is infant botulism. The symptoms such as constipation, weak muscle tone, poor grasp, lack of facial expression, and trouble breathing all match botulinum toxin affecting the nerves and causing flaccid paralysis. The definition of infant botulism is when Clostridium botulinum spores grow inside a baby's intestines and it releases a toxin that blocks nerve signals, causing weak, floppy muscles and trouble breathing. Question number 2. If this is indeed the case, do you start treatment at Dante's home or should you transport him to the local hospital? Dante should be transported to the local hospital right away. Infant botulism is a serious condition that can affect a baby's breathing, muscle strength, and overall stability. It requires close monitoring by medical professionals and may need breathing support and feeding support. This condition cannot be treated safely at home, so the best and the safest option is to take him to the hospital immediately. Question number 3. What should be administered to Dante at the earliest opportunity? The earliest treatment is Baby Big, also known as botulism immune globulin. It is an antitoxin made specifically for infant botulism. Baby Big helps neutralize the toxin already in the bloodstream and reduces the severity and the length of the illness. Question number 4. How do babies acquire this condition? Babies usually get infant botulism by ingesting spores of Clostridium botulinum. The spores can germinate and grow inside the baby's intestine because their gut is still immature. Once the spores start growing, they release the botulinum toxin that causes the symptoms. Common sources include honey. This is the biggest known food risk for infants under 12 months. And then the other one is dust or soil in the environment that may enter the baby's mouth or be swallowed accidentally. This infographic shows the most important prevention message. No honey at all for infants under 1 year old. Not on pacifiers, not in food, and not during breastfeeding. The scientific name of the organism is Clostridium botulinum. It can cause different forms of botulism: infant, foodborne, and wound botulism. In this case, we are focusing specifically on infant botulism. Clostridium botulinum is a gram-positive rod-shaped bacterium. It is an obligate anaerobe, meaning it grows without oxygen. It forms endospores, which are very resistant and can survive in honey, dust, and soil. The bacteria produce botulinum neurotoxin, one of the most powerful toxins known. This slide shows Clostridium botulinum under the microscope. It is a gram-positive bacterium, which means it stains purple when we do a gram stain. The cells are rod-shaped, also called bacilli. They are usually seen as a single rods, not in clusters or chains. Some of the cells form terminal endospores, which give them a drumstick appearance. These endospores are very resistant and allow the bacteria to survive in the environment for a long time. These are the major signs of infant botulism. Floppy muscles, also called floppy baby syndrome, constipation, weak cry, poor feeding, dropping eyelids, no facial expression, and difficulty breathing. Dante shows several of these symptoms which supports the diagnosis. This picture shows the difference between a normal baby with strong muscle tone and a floppy baby with weak tone. A floppy baby's limbs hang down, the head drops, and they cannot hold themselves up. The mode of transmission is ingestion of spores from honey, dust, and soil. The portal of entry is the mouth, and then the spores travel to the intestines. Once there, the spores germinate and release toxin. For infant botulism, treatment must happen in the hospital. First, the baby needs immediate hospitalization so the healthcare team can watch their breathing and overall condition closely. The main specific treatment is baby-big or botulism immune globulin. This antitoxin helps neutralize the botulinum toxin that is already in the baby's body. In addition to baby-big, the baby needs supportive hospital care. This includes breathing support, feeding support, careful hydration and nutrition monitoring, monitoring vital signs, preventing complications like pneumonia, and physical therapy to help regain strength. This is what baby big looks like. It is given through an IV and has been shown to greatly reduce recovery time for infants. There is no vaccine for infant botulism. The best prevention is simple. Do not give honey to infants under 1 year and limit exposure to dust or soil that may contain spores. These are the references I used for my research, including CDC, Cleveland Clinic, Medline Plus, and the Infant Botulism Treatment Program. Thank you for watching my presentation. I hope the information I shared today give you a better understanding of infant botulism and the steps needed to keep babies safe. Thank you so much and have a blessed day.